So we're at Hollywood Private Hospital today, and at Hollywood we have the latest version of the Da Vinci system, which is the XI machine. The XI machine is a step up on previous generations in that it goes to a different configuration. What this gives us is more dexterity, longer reach, more aptitude at placing our instruments, and above all, what I found is a much better vision system. At the end of the day, this is all about vision. Because we are not holding on to instruments that are connecting with the patient, there's no feel. This is like playing a video game rather than driving a car. So what you see becomes critically important. So when you're asleep during your surgery, you don't get to see all of this technology. So I thought we'd take this opportunity to show you through the basic components of robotic surgery. This stack here is really the brains of the robot. It's a massive computer that is doing a lot of work during the procedure, and being a medical grade computer, this is not allowed to make mistakes, so it's very different to other computer systems. What you can see here looks very, very simple, but behind it all, it certainly is not. It's made very simple for us so that there's very little that can go wrong and very little that we need to input during the surgery. This brains is connected to two other components, the patient bedside cart and the surgeon console, via a fibre optic cable. So to show you the patient bedside cart, this consists of 4 arms, and the notable thing in the Da Vinci XI model is how slim and small these arms are. So we can use this not just for prostate surgery but for other surgeries where spacing and difficulties existed with the older model. Each of these arms is capable of being moved independently, and you'll see soon when we connect it up to the surgeon console how that dexterity actually works. But we're able to access through long instruments deep into the pelvis, into areas that normal surgery finds very difficult to access. If you come over here, this is where I spend most of my day, and that's at the surgeon console. The surgeon console is a very interesting device in that it gives us the best ergonomics of any setup that I've ever used. Normally with keyhole surgery, you are holding the instruments directly, and that only gives you the dexterity to move in or out or rotate. And that is a very limited thing in a tight space. So during the surgery, your head sits inside this 3D visor. It's a little hard to tell through the camera, but you can see through the 2 eyes, you get a 3-dimensional view in very high definition of what we're looking at. This is much more detailed than anything that we ever saw during open surgery. So one of the unique differences between laparoscopic and robot surgery is we're able to use our feet. You'll notice that I don't have any shoes on, so I can feel the pedals. They've all got different ridges on them and they're in different positions. This allows me to control 4 instruments in a very seamless way. The first pedal I'm going to show you here is a camera pedal, and when we press that, I'm no longer controlling the operative instruments, but I can move my camera around. This one here is a clutch, and a clutch is the same as it is on a car, that when I press this, I can move my hands, but the instruments inside don't move. That's very important because I'm not physically connected to the instruments. My hands can get into very strange positions, but the instruments will be very different. On the right side are my diathermy pedals, and the bottom ones are here for coagulation, the top one's for cut, and it's very intuitive in that the right pedal is for the right instrument and the left pedal is for the left instrument. To swap between my instruments, I have another pedal on this side, which is really easy to tap and to change over to a different instrument. So now looking at my hands are connected to what looks like an awkward array of different connections, but what this gives us in reality is an infinite degree of freedom where we can move around very much like having a wristed, normal little hand in there. After a while of doing this surgery, the instruments start to feel like they're your own hands inside. What we're able to do here is to open and close the instruments, rotate the instruments, and move them back and forth with ultimate control and precision. When you're doing movements like suturing in very tight spaces, this dexterity is just a world away from what we're used to laparoscopically. So what you can see here is that we have ultimate control and dexterity. It's a little hard to explain the benefit of the 3D vision, but when we have 3D vision, because we can see all of this in 3 planes, your brain is able to much more accurately position where your hands need to be in space. And in prostate cancer surgery, it's these minor little differences which make the difference between good nerve preservation and not good nerve preservation. When we're operating, we are looking to see our tissue planes. And with keyhole surgery, we exploit those great views to make sure we're always in exactly the right place. And if we are, we're able to achieve just much better outcomes in terms of getting rid of cancer and keeping function. So at the end of the day, what does this give me as a surgeon? What I've found is that it has made it so much easier for us to be in the right place at all times. The vision that we get from this console and this system allows us to see the difference between what's normal healthy tissue and what's not, what we need to keep and what we need to take. And we're able to stay in the right plane to reduce bleeding and improve the outcomes. What we found reviewing our own results is our success rates with complete removal of cancer have improved with this machine, our results with water control and our results with erections. All of these have become better in standard operations. What we've also been able to do is push the boundaries in terms of what's possible with surgery. There are patients we're operating on now that were not candidates for surgery even only a few years ago. And that's largely because of the dexterity and safety of this machine. We're able to remove all the lymph nodes from the pelvis, and we're able to cure people who were previously incurable. And for that reason, I don't think I would ever go back to how we were operating before.